Morning, friends. I'm actually not alone. I've got Debbie Zwicker with me. I don't know if you can see at least part of her in the frame. So I'm kind of just going to kick things off and provide a little bit of kind of background and context. And then, Debbie's really going to be the star of the show with her Script Assist program. But I'm the director of the Fairfield Medical Center Foundation, and that's the fundraising branch of Fairfield Medical Center. And sometimes we get the question, why would a hospital need to fundraise? And a hospital needs to fundraise because Fairfield Medical Center is actually a nonprofit. So that means that we are kind of a giant community-centered organization that serves patients from all different backgrounds and walks of life, regardless of their ability to pay. So if you think about that, I know that a lot of you are business owners and you work for businesses. From that standpoint, if you're providing a large number of services to vulnerable populations who can't pay, it really helps to have donations and community support to sustain your operations. So that's really where the foundation comes in. In a different sort of non-pandemic year, we would be doing a lot of fundraising events that would be kind of in person, like wine tastings and golf outings and things like that. We've kind of pivoted recently to doing more online fundraising and grant writing and things like that to sustain our operations. And then the foundation just allocates that money back to the hospital to support the community in a lot of different ways. And so some of the things that we work on behalf of the hospital, we work really closely with our cancer care and infusion center. And a lot of the work that we do there is covering cancer screenings for patients who wouldn't otherwise be able to afford those screenings. And that's really important because that can be life-saving. If somebody postpones a screening because they can't afford it, then by the time that cancer is detected for that person, it may be too late. So we really want people to go ahead and get those cancer screenings, regardless of whether or not they can afford them. So last year, we covered $27,000 in cancer screenings for patients in our community, an additional $5,000 in women's health screenings and women's health services. We also work closely with cardiovascular rehabilitation. So if somebody has a heart attack and they have a heart surgery, there's actually a long road to recovery with that. It's not just the surgery and then they're kind of back on their feet. They have to sort of rehab that heart and kind of get their cardiovascular system up and running again. And that's going to be really important for them in their long-term health. And so if those people don't go through cardiovascular rehabilitation or they think they can't afford it, the likelihood that they'll end up in the hospital again is pretty high. So we step in and help those patients. We have a cardio rehab gym here in the hospital. And so last year we covered $11,000 worth of cardiovascular rehabilitation for patients who needed it. We also do a lot of equipment purchases for the hospital. The big one that we've talked about quite a bit is a linear accelerator, which is a piece of cancer care treatment equipment. And the foundation was able to raise, with the help of our board and community, $850,000 for that piece of equipment. But we also purchased smaller pieces of equipment too, like ambulance cots, scales for the heart failure clinic, just kind of equipment throughout the hospital that might be necessary. And last year, we also established a COVID relief fund. And so we raised about $52,000 for COVID relief here in our hospital, just to sort of help our patients through that difficult experience. And so we purchased a respirator. We already had those equipment on site, but we were seeing an increased need. So we purchased a respirator, a vapotherm, which is also a piece of respiratory equipment, feeding tubes, PPE, and things like that, just to help the hospitals meet that rising need. One of the programs that we've seen here that we serve that's seen a lot of increase in need, however, is our Script Assist program. That's a program that a lot of people don't necessarily know about, but it touches people from all walks of life, people who aren't employed, people who are employed, and it's really just something that helps patients get the medication that they need to sustain and prolong their healthy lives. And so Debbie Zwicker plays a really, really critical role in that. She's our coordinator. And so let me kind of introduce Debbie to you, and then I'll kind of turn the screen over to Debbie. Debbie has worked for Fairfield Medical Center for 19 years. She was the OSHIP coordinator for 9 years and has been OSHIP certified for 15 years, and she can explain what that means. And then she also holds an associate's degree in medical administration. And like I said, she is the one-woman army that is the Script Assist team. So Debbie, take it away.
Hi, thank you for having me. So OSHIP, it's OSHIPP, is Ohio Senior Health Information Program, which means I'm certified with the state of Ohio, and really any state, to help Medicare people find plans that benefits them every year during open enrollment throughout the year when new people are ready to retire. So for the Script Assist program, back in 2009, we found a need for doing something to help our Medicare people. because we were finding a lot of Medicare people were going home with medications. They weren't filling them because they couldn't afford it. So we started this program. It is fully funded by the foundation. So I work for Fairfield Medical Center, but my income comes directly from the foundation. So it's 100% funded by them. As of right now, well, it's actually as of the end of January, overall costs, we have saved over $29,836,664.84 to our Medicare people. This year alone, I've saved almost $2 million, and this is only as of the end of January. February's numbers have not gone in yet. Last year was almost 13 million that we have saved our patients. This year alone, I've already added 140 new patients just in the month of January. Last year, due to COVID, I added 590 new patients. So what the program does is I work closely with a lot of drug manufacturers. I'm able to go out there and find free medication for our Medicare people or self-pay people, or even some people with insurance. Some people here at Fairfield Medical Center, our employees can get approved. If we can show that there's a high deductible and people cannot afford their meds, I can then get it for them for free. I do all the applications. The patient just mails me in a copy of their income, sign the application. They do sign a HIPAA release form that gives me the okay to work on their behalf. I work closely with all the doctors. The patient just has to sit home, wait for the meds to be delivered to their home every 90 days. At the end of the year, I redo the application and we start the process over. So due to COVID, we have found that there are at least 4 drug companies out there now that will give away free medication without the patient spending any money. And a lot of that is the insulin and inhalers due to COVID. So if you know of anybody that does need the help, they're able to contact me directly here at 740-687-8860. Or they can reach out to Callie or Tracy, and she can get all the information to me and I can contact the people. Also during open enrollment, we always encourage people to have somebody who knows what they're doing run a Medicare comparison. We don't get any benefit back from doing this. We just want to find the plan that works for these people, because we're finding a lot of them may go out to agents or friends and they try to run it themselves. Then they find out after in January, their meds are not covered. They've got all these thousands of dollars in medical spending at the pharmacy. So we encourage them to reach out to me during that time and let us find a plan that's going to work for them. So it doesn't take that long. Usually within 30 days, they get approved, they get their meds shipped. The least amount I've had everything completed and done was 7 days, which is really quick. Another program we also help is the foundation gives me $7,500 to help people when they're in the hospital to go home with their medication. We get a lot of Medicare people in here, you know, if they're on limited income, they get a check the first of the month. They're in here the middle toward the end of the month and they have to go home with the prescription. They're not going to be able to afford it. We've got the funds to help them go home with that med. So we make sure they're not going to come back into the hospital. I love my Medicare people, but I don't want to see them here in the hospital. I'd rather see them just come visit me for their medication and needs, and that's it. So if you have any questions, I'm open to them.
Debbie, I don't have any questions in the chat. If anyone has anything, you can go ahead and unmute yourself and ask, or you can put it into the chat, either way.
Did you say how many people? I know you said the amount like that you saved, but did you say how many people that you work with like on like yearly?
Right now I have about 1,400 people in the program that I help. Yes.
A lot of people.
Yeah.
How many could you handle, Debbie?
I'm almost at my capacity, but I'm willing to take anybody that needs the help.
And are a lot of your people that you help, are they repeat customers, or are they people that maybe you throw them a lifeline and help them out once and then you don't see them
Oh
back?
no, they're lifeline.
Mm-hmm.
Once they're on the program, they can stay on the program as long as they need to. 'Cause
So do you help with the HCAP process, or is that a separate entity in and of itself?
No, well, the HCAP program is here through the hospital, and that is based on income also. If I have a patient in here and I'm working with them on script assist and I see they have outstanding bills, I've got the HCAP applications in my office, and I go ahead and have them do that at the same time. So we can help eliminate all their bills they have here.
Does someone have to be a patient at Fairfield Medical Center for you to help them, or do you help anyone that needs help with their prescriptions?
I will help anyone. I've had people from Florida that my mom knows that's called me, and I can print off the applications and I'll mail it to them. Usually anybody here, as long as our doctor or the patient is affiliated with us one way or another, I can help them. So I've gone as far as Athens County, Perry County, Fairfield County, Franklin County, Athens. I go all over.
Debbie, can you walk through the process again? Do you just call in to get to you, or is there a spot on the website where someone can apply, or what's the easiest way to get that done?
No, they would have to call me. Since we're not having people come directly up into the office, everything right now is done by mail until we lift the COVID. They can call me, or the doctor calls me. I can get a referral from anybody. Once I get a referral, I contact the patient directly. I tell them exactly what's needed. I then mail them the application with the HIPAA form and a letter highlighting everything that's needed. I even put little tabs that says sign here, so they know exactly what to do. They mail it back to me, and in the meantime, I'm also reaching out to the doctor to get the prescription from them. Once I get everything back, I fax everything to the drug company, and they're usually approved within 3 to 4 days.
Sounds like a pretty easy process.
It is.
Are you meeting with people virtually via Zoom? And how does that work when if you're working with a vulnerable or at-risk population that maybe doesn't have access to?
By mail,
Okay.
and then I do it by phone call. I don't have a laptop to do the Zoom, so
Okay.
everything is done by mail and by phone.
Okay, great. Well, that's a little more accessible too to all income levels.
Exactly, yes. So if you know anybody that needs the help, feel free to give them my number.
All right.
Hey, Debbie, this is Karen Dawson. This is Karen Dawson with CareSource. I have a question. So what's the name of the prescription program that you're working with through the foundation?
It's Script Assist. There is a program that the foundation pays for that's on my computer only. It's $1,000 a year, and it helps me get access directly to all the drug companies. It's all the manufacturers, gives me a list of all the medications that I can get. It will tell me what's available, what the guidelines are, what I have to do, and everything is quick and easy.
Okay. I wanted to know, I had a question earlier this week. Someone from my company was looking for an OSHIP certified rep. Are you interested in talking to them?
Yes,
If that's possible?
Yes, I also
I can give you a call a little bit later.
Yes,
Okay.
It was Sharon Scruggs and
Okay.
I that were the OSHIP
All right.
certified, but I am also on the OSHIP website as the counselor for Fairfield County. So they can reach out directly to me.
Okay, sounds good. Thanks.
You're welcome.
Okay, I don't see any other questions in the chat, so we might be good. Tracy, did you want to add anything else about the foundation, or you think you have it covered?
You know, I mean, I think I have it covered. I think what I would say, and I mean, this kind of almost goes without saying, is that, you know, as the hospital is a nonprofit and the foundation is a nonprofit, and we're supporting efforts like Debbie's effort here, community donations make a tremendous difference. So if this is something that you're inspired to support, we would really appreciate that. You know, we can receive donations through businesses, through individuals, and every dollar counts. And so, you know, if you're moved to support this type of an effort, we would sincerely hope that you would just make a small contribution and just help us keep Debbie and her program strong.
You can make those donations through your website, correct?
You can make them through the website. You can call the foundation. You know, whatever works for you. We can receive checks. We can even go out into the parking lot and receive cash donations. We've had that happen from time to time since we're not letting people in the building. So, you know, whatever works for you, you know, we will meet you halfway. But every dollar really counts, especially in a difficult time like this. So thank you for your time and thank you for your support.
Thank you. Thanks so much for being here. Thank you, Debbie, for the information too. We had a lot of interest. I had a lot of people emailing me about this program. So I'm excited to be able to put that on our YouTube channel and share it out.